Hi guys, today let us discuss the free 120 2021. Let us start with the green portion followed by blue then orange. There are around 50 to 60 statements, that's it. Okay, yeah. This is a very important topic. I saw this topic repeatedly getting asked in many NBMEs. What is dyslexia? It is difficulty reading out of words. A child with normal intelligence and normal social functioning who has difficulty sounding out specific words, it is known as dyslexia. It is a spectral disorder under specific learning disorder. Whereas a language disorder means difficulty framing sentences. For example, instead of telling I'm going to school, a kid tells me go school. Okay. A speech disorder is mispronunciation of words. Instead of speaking out a rabbit, he tells us that instead of rabbit he tells us wabbit. Stuttering or childhood onset fluency disorder is like instead of speaking out the word rabbit, he speaks out like rabbit. Okay, yeah, getting my point. Okay, next one about the pleural fluid analysis in cancer. mm, uh, as you know that it is exudate, and the most common finding you see is high protein. It is the usually the most preferred answer. If not, then the second answer is high LDH. Low glucose comes as the not the most common answer. Low glucose is primarily the main answer if the presentation is given about empyema. Okay, this is about the Church-Strauss syndrome, small vessel vasculitis. When NBME gives you a presentation of asthma with neuropathy and also hemoptysis, think of this and order ANCA antibodies. In ethics, while communicating with the patient, pick the option with the open-ended question. The question has to be like, mm, what do you think of your current disease? It has to be like this, so that the patient need to like explain, talk about that particular disease. And you should not ask like questions like such that the patient tells yes or no. Okay, getting my point. Instead needs to like patient instead needs to explain or talk something about that disease. Okay. Immunosuppressants given after renal transplant and the patient presents with a diffuse vesicular rash along with the right upper quadrant tenderness with the mild LFT elevation. Think of a disseminated zoster. Usually constitutes more than 20 vesicles outside of the primary dermatome. Evaluate lungs and liver. Treatment is IV acyclovir. This is just a formula, please go through this once. And okay, normal AA gradient, it is age by 4. Okay, next coming to orange. Okay, this is about diabetic neuropathy. A diabetic patient with peripheral neuropathy, and he has warm swollen erythematous midfoot after minor trauma. The diagnosis is acute Charcot arthropathy. Don't confuse this with and don't mix up this with osteomyelitis. Okay. Treatment here is immediate immobilization or pressure offloading. Surgical reconstruction is reserved for chronic disease or failed initial management. In osteomyelitis presents with a fever, elevated inflammatory markers like ESR, CRP, Okay. Yeah. Substance abuse disorder. It is one of the important risk factors in suicide. Okay, whenever you see pancreatitis plus history of postprandial right upper quadrant pain, think of gallstones. Do an upper abdominal ultrasound. Monoglutamate syndrome or Chinese or thigh restaurant syndrome. I have seen this first time in this test only. Sudden flushing or chest pressure or impending sense of doom occurring after intake of a meal, Chinese meal or a Thai meal. Okay, this is called as a monosodium glutamate reaction. Whereas systemic mastocytosis usually uh, it presents recurrently, um, and it has a chronic history, and it also manifest with other features like urticaria pigmentosa. Don't mix up this with anaphylaxis. Okay. Mm, Normal CT scan is enough for detecting lung cancer, whereas HRCT, high resolution CT scan, is required to see diseases like interstitial lung disease. This is again a very important topic. I have seen this repeatedly getting asked in many NBMEs. Asymptomatic microprolactinoma, if the size is less than 1 centimeter, you need not to treat this. Okay. If the size of the tumor is more than 1 centimeter, or if the tumor is symptomatic, you have to go with the medical management initially, that is cabergoline and bromocriptine. Surgical resection is reserved for cases which are refractory to medical therapy, or if the tumor size is more than 3 centimeters, or if the tumor increases in size while using the dopamine agonist. um, you have to contrast this with the other pituitary tumors where you will be initially directly going for the surgery, whereas in prolactinoma you have to first deal with the medical management followed by surgical. Okay. Okay, next, infant with sickle cell disease. This is a case of sickle cell disease. You have to give daily penicillin prophylaxis until age 5. Till 6 months, due to presence of HbF, infants are occasional, like often asymptomatic. This is again a ethics communication question. Receiving bad news can be a disorienting or a shocking experience to any patient. Therefore, it would be important to speak with the patient in a few days or weeks after she has time to fully process the news and think about her care. Okay. Let us start with the uncolored portion. Best prevention in meningococcal infection. The best prevention is vaccination more than isolation of the carriers. In research involving the subjects, signing off an informed consent doesn't necessarily remove their autonomy. They can withdraw at any time without prior information to the research team. Okay. New onset heart failure with the recent viral illness with like history of 1 week uh, plus mitral regurgitation. Think of myocarditis. If there is history of 2 to 4 weeks and there is mitral regurgitation plus other features like migratory arthralgia, subcutaneous nodules, erythema marginatum, think of rheumatic fever. Okay. Using costly, heavily marketed technology with limited expected benefit when less expensive alternatives exist reflects poor resource stewardship. Statin combining with amiodarone is dangerous. It potentiates the risk of myopathy. Check CK levels. You can investigate ALT levels if there are signs of hepatotoxicity. Again, septic shock. This is again a repeatedly asked question. The treatment management starts with administration of IV fluids, followed by vasopressors like norepinephrine, followed by IV hydrocortisone uh, if it is refractory to the previous management. um, and next, like in this free 120, they gave this statement: IVC, inferior vena cava, is 1.5 centimeter in diameter, and it is non-collapsible. Okay, this is like NBME way of telling intravascular volume is adequate and stop giving fluids. So, like, give the next line of management, that is vasopressors or IV hydrocortisone. Okay. Patient with the left ventricular echinus post MI, suspect left ventricular mural thrombus. Okay, and if the patient develops bilateral leg ischemia with absent pulses, it is probably due to aortic embolus. This is again a like a repeatedly asked topic. This is about EMTALA violations. uh, Even if the patient doesn't have the required insurance, or the patient's treatment is not covered under their hospital program, you first have to screen and evaluate any patient, even if they have insurance or not. Okay. In hospice patients, morphine is used to treat dyspnea, that is air hunger, not just pain only. uh, it is used to relieve the suffering, and like it takes priority over non-invasive positive pressure ventilation, which causes discomfort and prolong the dying process. mm, Next, and you have to differentiate this with death rattle. Death rattle is increase in secretions in the respiratory tract. You have to treat that with uh, scopolamine or glycopyrrolate. Whenever you see infant or toddler with unexplained skin lesions or unreliable history by the parent, with like skin lesions like bulla, bruises, burns, fractures, suspect abuse, report to child protective services immediately. Staircase pattern seen on CTG is classic for uterine rupture. First line pharmacological treatment in cirrhosis ascites is spironolactone. Use propranolol for varices. Lactulose promotes conversion of ammonia to NH4 plus, whereas rifaximin kills the gut bacteria. It leads to decreased production of ammonia, increased startle, and subacute unprovoked altered mental status. It is indicative of CJ disease, Creutzfeldt-Jakob disease. Look out for 1433 CSF antigen in the CSF analysis. Frostbite. What is the immediate treatment? Submerge the feet in warm water. You have to do it rapidly. Heat stroke, rapid cooling by submerging in cold water. Young healthy man has a bee sting. There are no signs of anaphylaxis or eye problems. Treat conservatively by applying ice to the local site. No prophylactic injection epinephrine is given. One-time hepatitis C screening is done to the age group 18 to 79 years. Bladder, kidney, pancreatic cancers. Most likely causative factor is smoking on NBMEs. Chronic ear plug use can cause otitis externa. Vactral anomaly can cause tracheal collapse, and it can lead to this lab finding: slow vital capacity more than forced vital capacity. First line treatment for viral or idiopathic pericarditis is NSAIDs or colchicine. Second line is steroids. Pleurisy is analogous to viral pericarditis, so treat it with NSAIDs. If pleuritic chest pain is mentioned, think of pneumothorax, pulmonary embolism, pericarditis, or pleurisy. Okay. Neonate presenting you with the sudden cardiovascular collapse after initially normal birth. Think of ductus dependent congenital heart disease. Start immediately with the prostaglandins. Prinzmental angina, the treatment is calcium channel blockers or nitrates. Combined variable immunodeficiency, think of lymphoma and do a lymph node biopsy. Usually presents with bronchiectasis, lymphoma, sinopulmonary infection, etc. etc. Usually in the age group 10 to 16. Insulin resistance is a fundamental response to injury or stress and is a well-known phenomenon in the post-op and post-trauma patient. Decreased uptake of glucose by insulin-sensitive tissues. This causes this. Okay, patients with the suspected necrotizing fasciitis should directly go to the ER, and you need to perform surgical debridement along with administration of IV antibiotics. This should be given like a more priority than administering a hyperbaric oxygen therapy. It is not the circulating nurse responsibility to read MRI. It is the doctor responsibility. This question is like you have to go through that in the exam. Worrying about a myriad of life issues. Patient may have component of illness anxiety or social anxiety disorder. So this deals with the generalized anxiety. Okay, Tanner staging is important. Please go through that. Testicles at high body temperature are at a higher risk of malignancy. It is the same reason why patients with cryptorchidism have higher chances of malignancy. Okay, with this we finish this free 120 2021. Thank you.